So if you've had problems with vertigo and you're wondering what medications can or should I take, today's video I'm going to look to go through those with you. Hi, my name is Dr. Greg Gersten and I've been helping people to remove the blockages from their health to live amazing, fantastic lives for the last 20 years. Now, just so you know, I want to start this video off is that medications and drugs are outside of my scope of practice. However, many people come to me asking questions about them. So I want to share with you what I share with them. The first thing I always share with them is that if you've been given a prescription for a medication, you've got to communicate any concerns that you may have with the provider who prescribed medications. Second of all, I always like to share with them concerns that I usually run into. So some of the most common things that people are recommended to take wind up being things like over-the-counter aspirin, Tylenol, Aleve, or pain relievers, or non-steroidal anti-inflammatories. These are really commonly used. However, they're not really always the best tool or answer. There's something easy you can grab that might be near you that can wind up possibly helping, but possibly not. Just because sciatica can be caused by so many things, the non-steroidal anti-inflammatory may or may not be able to help it. I find that a more natural way to wind up managing that inflammation on an at-home sort of basis is if you just use some fish oil, okay? You can use up to 1,000 milligrams of fish oil in most cases, and that'll help to reduce inflammation real similarly to a non-steroidal anti-inflammatory. It's way better to be consistently on it though, so that you continue to dip that inflammation and cut it out rather than waiting until episodes show up. Another thing that people get recommended are muscle relaxers. Now this is something that I don't think is usually a great idea, and because your muscles, when you have sciatica or lower back pain, they wind up guarding and protecting you so that you don't wind up breaking down anymore. So if we take medication to relax those muscles that are protecting us from right now, we leave ourselves susceptible to more and future injuries. The next one that I want to talk about is some sort of a powerful painkiller like a Vicodin or a Vioxx or an Oxycontin. These are really powerful medications that our patients come into us with and call on calls with me that they've been prescribed from their primary providers or their specialists. You gotta be real careful with these. These can wind up deteriorating the gut. They can wind up causing, just like the muscle relaxers, for that pain to be reduced so that you wind up doing your activities on damaged tissue and you cause tissue to become more damaged. All of these are things that you should be concerned about, and I think a great place to go to if you've been suffering with problems with sciatica winds up being a corrective chiropractor. They're not going to tell you what drugs or medications you should take because that's outside of their scope of practice, but they may give you some cautions about it so that you can make the best decision that you can. Once again, my name is Dr. Greg Gersten, and thank you for letting me be a part of your health.